Ho. So, good afternoon, one and all. Here is, I think that near about 34 people's. Okay, friends. So, very good afternoon to all of you. Today is the International Accounts Day, or we can say that at least a National Accounts Day because today is 31st March. So might be a few of you are busy in completing their accounts and their with busy with their CAs and accountants for this last day of economical year. So in today's lecture or in today's webinar, we are going to. Am I audible? Am I audible and visible to you all? Somebody please put into chat box that am I visible and audible? Okay. Thank you all. So, as you have seen on this slide first, that today we are going to discuss about the sport injury management and Ayurveda perspective. So, or the role of Ayurveda in uh, sport injury management. So, this is a very emerging topic nowadays because sport injuries are not happening only to the professional sportsmen, but they are been happening to everybody around you, like the school children, the adolescent girls, the enthusiast runner, the enthusiast cyclist, the gym freaks, also the yoga practitioners, the yoga teachers, and also the persons who have started the yoga or the Zumba, any kind, or even though the most common in the dancing peoples who are the professional dancers or the seasonal dancers. Now there is a season of wedding. So in weddings also nowadays the dancing and one of the major event have become the Sangeet. So during Sangeet also there are lots of sport injuries happening to the ankle joints, to the knee joints, which are very common. So uh, sport injury is not related only to the sportsman. Basically, that's what I want to tell you. And the sport injuries are very common among the professionals like police or involved in the defense activities like army personnels, the CRPF personnels. All these defense forces personnels are also prone to the sport injuries. So basically, we can say that the sport injury is a very common topic or a very common reason for all the youngsters, especially youngsters and young adults. Although all the ages come under the classification of sport injuries, but most commonly, it is a very most common reason for the adolescents and the young adults and the youngsters to visit the doctor's clinic or the orthopedic clinic or the Ayurvedic clinics for the pain due to some or other kind of the injuries or a sport injury which we call it. Why they are sport injury called that as sport injury? Because they are very common into the sports. But nowadays our life has become itself a big sport and we all are playing on the ground of this life. Hence, it is a very emerging field also for the Ayurveda practitioners because Ayurveda had got a potential uh, what we can say a potential field of expertise for the Ayurveda peoples to enter in. So, just to uh, emboss, just to bring into the point of view about how important is the sport injury, I will just play a small video of our PM, Mr. Narendra Modi, what he is speaking or what he is appealing to the nation or the all the Ayurvedic doctors. So please, we will just start our lecture with this 1 minute video. So uh, you have seen that how please somebody tell that the video has played or not. Video is not played. Okay, I will try to play it again for you. Now is it playing? हाँ सर,
सर वीडियो ऑडिबल है आपका?
वीडियो काय माहिती ऑडिओ का नाही येत यायला त्याच्यात. Okay, I will share this video in the uh, I will share this video in a group, so you can all see that. So there is some technical glitch in it, and hence the video sound is not matching with the PPT. So I will share this into the group. Now let's see the basically I will brief what PM Modi has said into the video. PM Modi has said that Ayurved peoples and Ayurved doctors should enter into the unexplored field by the Ayurvedacharyas, like the sport injury management. And I would also like to update you that Ayush Ministry has also uh, started some schemes and also started some of the programs to incorporate the sports medicine with the Ayush. So there are these schemes, and the government Ayush department is start planning to start the Ayush sport injury management centers. The first already present in the Kerala, and the second one is starting in Karnataka in Mangalore. So there is a lot of scope for this field to the Ayurveda doctors and Ayurveda practitioners. Now is the PPT visible to you all? क्या सबको PPT दिख रहा है? Please, somebody put into the yes. Okay. Thank you. So first of all, चालू करते हैं. Just understand what is the sport injuries. So injuries that most commonly occur during the sport or the exercise. And जैसा कि हमने बोला कि उनको स्पोर्ट्स इंजरी इसीलिए कहा जाता है कि स्पोर्ट इंजरी मोस्ट कॉमनली स्पोर्ट या एक्सरसाइज करते वक्त होती है. मगर इसका मतलब ये नहीं कि जो प्रोफेशनल स्पोर्ट है, प्रोफेशनल एक्सरसाइज है, कोई भी एक्टिविटी, फिजिकल एक्टिविटी करते वक्त ड्यूरिंग एक्शन अगर कोई इंजरी हो जाती है तो वो इंजरी स्पोर्ट इंजरी की कैटेगरी में आ सकती है. लाइक डांसिंग, वॉकिंग, स्टेपिंग, क्लाइंबिंग, एनीथिंग. जो भी एक्टिविटी हम कर रहे हैं तो दैट कम्स अंडर द स्पोर्टिंग इंजरी, स्पोर्ट इंजरी. Now, what are the common cases, common causes for the sport injury? First, accident, poor training practices, improper or improper equipment के साथ exercise करना, warm up और stretching की कमी. This is the most common and the most popular reason for the sport injury, that insufficient warm up. आजकल हम डांस, किसी की शादी है, किसी का कोई फंक्शन है, where we have to perform the couple dance or the solo dance, we directly start dancing. We don't do the warm up and stretching after the dance. We directly start the dancing, or we directly start the physical activity. For example, nowadays the various competitions are very common among the professionals. For example, like Doctors Premier League, Doctor Sports Game, Doctor Badminton competition. Every NEMA and all Ayurvedic associations are organizing the sports event for their members, and all in among all the sectors, like CA Premier League, CA Football League, everything, everywhere in the every aspect, the sporting events are being arranged. The indoor and outdoor both are organized, and these all players are basically not the professional players, and hence they do not follow the proper protocols for the performance, proper protocols for the playing that particular game, and got injured. So this is very common reasons for the, or common causes for the sport injuries. Now, what exactly are the causes for the sport injuries? Then So the external forces, the internal forces, the overuse and unexpected forces are basically the actual causes of the injury which happens. For example, external forces means that somebody had been colliding with the opponent, or you collide, or the patient collides with something, or some object, or some person. The internal forces are because of the overuse or the overstretching, or if you are not properly trained athlete or a properly trained person, or you are exerting more forces. In that conditions also, the muscle tear, muscle fiber ruptures are common, which can be considered as the internal forces. The overuse, if you are doing a particular exercise, if a person start running on the basically on the tar road or cement road, and that because of the friction of a particular joint, because of a friction of that uh, knee joint, that person can be there. That person can be affected with an injury because of the friction in between the anatomical structures like ligament, tendons, and bones in the particular joint. Like in knee joint, the ACL may be tear, the meniscus and the patellofemoral bursa, they can be got frictionized and can cause the severe knee pain. So this comes under the overuse injury. Unexpected forces are the forces which are not covered in above three reasons. Like there are some chemical reasons, because of some medicines. There may be a osteoporosis because of some medicine. There is a fatigue like of thing. The most common thing we can unexpected forces is like that. If a metformin is the most common reason for backache, because it weakens the flexibility of the muscles. These are some unexpected. These are some unexpected forces. Now the training errors. These are more common with the professional sportsmen. But as I have told you, for example, a person or a lady has the program or a performance of a dancing, and she has not practicing since last, and suddenly she or he start dancing, then there are more chances that the fatigue muscles or the stiff muscles got injured. Then excessive volume, the practicing or doing a particular sporting activity or any kind of activity. For example, if a person is doing the excessive cycling, he may be suffer. He may suffer from the sport injury related to back or the knee joint. Then also the rapid increase. For example, you are running and you are doing the morning walk daily, and one fine morning you think of running fast, and you started running more speedily than your usual speed, then it is the rapid increase. So it may also cause the overuse or the stretch injuries. The most common injury, severe the most common and severe injury while rapid increase in running is the stretch fracture. I would like to share with you, in the last season when there was a mega recruitment of police department in Maharashtra. All the youngsters and enthusiasts start running for their selection into the police recruitment, and I have managed around 64 to 68 cases of stretch fracture only because of this rapid increase into the activity. The same is excessive incentivity, sorry, intensity. The excessive intensity that you are practicing or you are enforcing more effort or more pressure on your joints and your body than your capacity. That may be the one reason. Then inadequate recovery time. If you got an injury and you do not allow that injury or that structure to heal completely, then also a major injury can happen. Okay, now coming to the next topic, that is types of injuries. Those are types of injuries. What types of injuries can happen or can be covered into the sport injury? What is the scope? You can say the scope of injuries which can be covered under this particular field of sport injury management. So the acute injuries, all that we call that acute pain, and we all are very much familiar with the word that acute abdominal pain, acute lumbar pain, acute lumbago, acute cervical spasm. But what when we call that acute injury in sports, particularly, or sport injuries? So the acute injuries occur when there is a sudden stress on the body. So where there is a sudden stress on the body, there are three main causes: the collision with opponent or obstacle. Then when you collide with it, then there is a contusion injury, and that contusion can potentially damage the soft tissues and hard tissues of our body. Then being stuck by any object, suddenly you are anybody is doing an activity with a full speed or with a full beam, and suddenly he got obstructed by any or object or anything, or in suddenly he can be uh, fall, or he can be tangled with the opponent, or can his or her legs can be tangled to each other, and she will got the injury. Then third is the falling from a height or a speed. This is also one thing that you have seen many times, that athletes are running with the speed for in football, in cricket, or any track and field game, or any team game. This is very common to fall while in speed and with height. So it will cause a potential injury like soft tissue damage to the bone fracture or anything. So these are called as the acute injuries. Many injuries can come under this: contusion injuries, the concussion, then the ACL tear, the ligamentous tears. The result may be anything of these acute injuries. Now, the chronic injuries. So, what is meant by the chronic injuries? As we are taking this lecture on this IIAS platform, so so only I am speaking, and I am considering it that you all are listening to me carefully. My words are reaching out to you. So please, somebody tell me that is everything going smoothly, that the slides are moving, and I am audible to you all. Please, somebody type yes in chat box. Yeah, thank you. And the slides are already moving smoothly. Yeah, thank you, ma'am. Thank you. So we will continue that. What is the chronic injury? So in regards to chronic injury, in regard to sport injuries. So chronic injuries are caused by the continuous stress. As we have seen in the acute injuries, they are because of the acute stress or the sudden stress on the body. The chronic injury caused by the continuous stress on the body part over along a long time. For example, a runner is running, or a boxer is boxing, or any of the athlete is doing his regular activity with a bad posture. So that bad posture will exert the stress on the unwanted region, and that region will get hurted, and then it can be considered as a chronic injuries or chronic sport injury. Now, caused by training too hard, not allowing time to recover, poor footwear, and bad technique. So these are the bunch of this is a bunch of training error, you can say, that if not only in sports person, I have come across lots of patients who are obsessed to lose their weight, particularly in females or males who are overweight. What they do, they start over training themselves. They start directly gymming, they start swimming, or they starts running very hardly beyond their physical capacities and without proper increase in the strength. So these kind of people are more prone to get the injuries. Again, if you are using the wrong footwears, if you are using the wrong clothes also, because clothes are very important, very important into the sports injury, not into sport injury, in playing the sports or in sports training or any kind of physical activity, clothes are very important. Because I have seen lots of boys and girls and also some of the athletes who are running on their shorts, they are running on their uh, sleeveless cloths, their bunions, their sporting bras. So, what happened actually when you are running or when you doing any kind of activity in the gym or in the outdoor with these kind of clothes? What happens? Your body is warming up, and the temperature outside your body, the atmospheric temperature is low. So your body has to do more work. The body will experience more stress and also more thermal variations. And because of these thermal variations, because of this, your muscles, your ligaments, and your soft tissues get more stress, and they got more prone to the injuries. So all the gears, all the sporting gears, all the exercise gears are very play an important role in sport injuries. Then the third reason, which we have already discussed in short, that is the overuse injuries occur due to repeated powerful muscle movements. For example, a weightlifter is lifting a heavy weight daily without doing a proper stretching and proper warm up, and doing the same activity again and again and again. Then the these kind of injuries happen in the housewives, in office going peoples, or in general people. The most common example for the overuse injury is the tennis elbow or the golfer's elbow, which is also one of the most common sporting injury or the sport injury we can see in our daily practice. So tennis elbow is also caused because of the overuse. Okay, so these are the basic difference to be understood while dealing with the sporting injuries or these kind of injuries, and the classical thinking of the pain and injuries. Now the next part is the open injuries. The open injuries are basically of the four types which can occur during the sports or during any physical activity. The first is the cut. The cut that because of a punching, because of any sport gear, or because of any of the other reasons. The cuts are very common in boxing, judo, karate, in which the punching or the hitting game is there. So it should be uh, cut require an immediate attention to stop bleeding and allow the blood to clot. Then the grazes or abrasions. These are also very common in the sport injuries, and these are also common into the road traffic accidents and other accidents, uh, where the skin is scrap of the body and need to be cleaned carefully, because when there is a gliding or sliding and these kind of abrasions happen, there are the chances that the dust or any particles, soil particles, can be stuck into the skin. Then the open injuries are the another two type of open injuries are blisters. Generally, blisters are caused by the skin rubbing on the other surfaces. Might be these are the common site. I just you can see into the picture is the toe because of bad footwear. We also called as the shoe bite. This blister is because of the excessive friction. This can also be seen into the armpits because of missize t-shirts or missize clothing, and groin. These are some of the common sites. And then chafing is caused by the ill-fitting clothing or the material. These are not as severe as blisters or abrasions, but still they hurt more. Generally, it happens along the waist, along the where the belt is wore, on groin, or in the shoulders. On the shoulders, this kind of chafing is common, which should be also taken consideration. Then the close injuries. So the basically close injuries are of two types. That is, sprain occur when ligament and joint get stretched or torn. When the ankle sprain is the most common sprain or this kind of close injury, where there is no mark or scar or any kind of injury on the skin, but there is a potential injury beneath the skin. The strain muscle result from the muscle being suddenly and forcefully overstretched. The most common example for this is a hamstring stretch or hamstring pull. Most of you have seen this during the cricket matches, particularly in the cities where there is a more moisture, like Mumbai, Kolkata, Chennai, where there is a more moisture, there is more humidity. This kind of cramping, the cramping may lead to the strained muscle. The recent example is KL Rahul has got the hamstring muscle stretched, for what he have to undergo the surgery also. Then the close injury can also be the fracture. So you all know that fracture can be happen because of accident, and there can be a dislocation also. So both dislocation and the fracture, because of the twisting, because of the heating, because of any reason, the fracture is also considered as a closed injury. So we have seen these sport injuries and their manifestation. So ये जो हमने सारा देखा, we can briefly divide them or briefly classify them into the hard tissue injuries and soft tissue injuries. So the first classification we have seen are according to the mechanism of injury. Means that is it a acute, it is a chronic, is it a close injury, is it an open injury? Whatever the manifestation, whatever the reason of the injury, we have seen that classification. Now, this classification of sport injuries are regarding to the anatomical structures particularly. That is, basically hard and soft tissues are the two anatomical structures which got hurted while an injury happens. Okay, so hard tissue injuries are injuries to the bone, and soft tissue injuries involve the damaged skin, muscle, tendon, ligament, or cartilages. So, first of speaking, the hard tissue injuries. So, the hard tissue injuries are bone fractures. The bone either cracks or breaks. There may be a displaced fracture, there may be an undisplaced fracture. If there is an undisplaced fracture, we call it as a crack. And if there is a displaced fracture, we call it as a break. So the fractures, what the fracture can lead to? The fracture can lead to bursting and swelling, the pain due to nerve damage, the limb or area of the body where the break becomes immobile. Where there is a break, that particular part of the body or that particular arm becomes the immobile. Then if it is bad fracture, the area will look obviously deformed. That in the above picture, as you can see that in this, the leg of that particular athlete had been looking malformed. This is a sign of bad fracture. So basically, heart tissues are the fractures of different kind, and they may lead to the bruising or swelling or pain. Nerve damage may happen if there is a cold extremity. If, for example, tibia, radiation ulna got fracture, and you are feeling a cold extremity or numbness into the uh, palm or in the finger, then you may suspect the nerve damage in particular injury. Then coming to the soft tissue injuries, because in sporting or in the day-to-day life also, in daily practice also, you have to encounter more about the soft tissue injuries. If we can speak or we can uh, measure them, then only 20% injuries are because of the hard tissue injuries, and 80% injuries are soft tissue injuries. In vernacular orthopedic language, they are also called as the hot orthopedics and cold orthopedics. The hot orthopedics are the obvious tear, obvious fractures, and the cold orthopedics are the basically the injuries to the soft tissues. So the soft tissue injury can be an open injury also. That means that the skin has broken, blood usually escapes. Open injury includes the cut, graze, blisters, and chafing, as we have seen earlier. They all are considered into the soft tissue injuries. A closed tissue injuries in soft tissues can occur beneath the skin. There is no external bleeding, but closed injuries include bursting, pulls, strain, sprain, or the tear of the soft tissues. Now, to understand the soft tissue injuries severity, that which injuries are more severe to the soft tissues, then dislocation is the least severe injury. Cut is also not that severe, though cut, if it is a more larger cut, the management may be difficult, the suturing and all may be needed very promptly. Then brushing is basically the injury caused by the friction of two anatomical structures. This is also least here, but strain muscle is also comes to the fourth number, and going from least to severe. Then sprain or with the stretch ligament. If there is a muscle strain with the stretch ligament, becomes more severe because you have to work on the both the uh, structure, that on the muscle, tendons, and ligaments. So you can say it is as a sannipatat or the complex injuries. Then sprain with the torn ligament is very difficult because the fracture can heal into the about 28 to 45 days, but the sprain and the torn ligament takes larger time to heal. Then also it takes a larger times to recover completely and to be strengthened. And the first one is the blister, because in this blistering, if there is a blister on the soft tissues without any severe pain, then you may suspect the any of the thing below the first track. It can be a dislocation, it can be a bruising, it can be a strained muscle. Not only cut will be avoided, rest of all thing can be produce or can produce the blisters on the skin. Also, a fracture or an infected soft tissue can also produce a blister on the skin. Then one of the severe most type is the unconsciousness during the sport injury. So the concussion is the most common of the unconsciousness while playing the sports. The common causes are fainting, headache, head injury, heart attack or stroke, asphyxia, and shock. So these are the most common reason leading to the unconsciousness, leading to the concussion to the sportsman. So fainting may be because of the dehydration or excessive heat, or some of the medical conditions like aneurysm or any other issues which are basically related to the brain or stopping or obstructing the nerve supply to the brain. Then head injuries, these can be happen because of hitting by a sport gear, hitting by some object, or by colliding each other, the head collision to the other athlete. These all are common reasons for head injuries. Heart attack is nowadays can't you can't say that a sportsman can't have a heart attack, because we have the lots of examples. The sportsman playing in the ground and while playing got the heart attack. So heart attack is also can be happen during sports. Then asphyxia and shock. The shock may be osmolegal, the shock may be dehydrative. So these are the most common causes. In these conditions, you have to do the Vedna Stapan, Chikitsa with the Vedna Stapan Dravya, Parishek and all that. Now till now we have understood the injuries. Till now we have understood the classification of the injuries. Now we will try to understand the diagnosis of the injuries, that how we should diagnose the injury. So injury diagnosis, there are the certain protocols for the injury diagnosis. First of all, talk, then observe, then touch and feel. So here the palpation should be very very gentle. You should palpate what is happening beneath the skin, what is the warmth of that particular portion, what is the feeling of that particular portion, what happens to the athlete when you are pressing, what happens when you are touching it gently. So the touch is very important, the palpation is very important. Then you have to ask the patient to do the active movements. If the patient is able to do the active movements, it shows that the injury is not that severe. But if a patient is unable to do the active movements, you have to do the passive movements and try to understand that which structure, which anatomical structure is got hard. And then the skill test. The skill tests are particularly tests which required to in that sports particular. For example, a patient is complaining you that I have got the hamstring pain, I have got the hamstring pull, but I don't experience pull while pain while resting or walking or anything. I feel the stress or the pain only when I start running. So this is a particular skill test for that particular sport injury. Again, there is some of the tests, like for ACL injury you can do anterior test, the forward bending test, the backward bending test for the spasm in muscle or cervical region. Okay, so these all protocols every time should be followed during the diagnosis and treating of the sport injuries. Okay, then what are the structures involved actually into the sport injuries? That anatomical terms, or that which are the anatomical structures. The first is ligament. So ligament tear and ligament injuries are very common, as you all know, are very common into the sports persons. Nowadays they are very common among the other peoples. Then muscle, which are also called as myo, that is, for example, myositis or myochondria, myochondritis, myositis. These are the very common terms used. Then the joints are called as the arthro. So as therefore we call it the arthroscopy or arthroplasty. So basically these are the terms used for the joint. Arthro is the term. Then the tendo is used for the tendons, like tendosis, tendinitis. So these are kind of tendons. These kind of terms are you can find into the MRIs. For shoulder injuries, the most common cause is the supraspinatus muscle tendon, which is called as supraspinatal tendonitis, which is a very common sport injury, supraspinatal tendonitis. Then the cartilage are the cartilage basically come are the structures between the two bones. so that they should not glide, or the cartilage can be compared with the uh, kandara in Ayurveda. And it can be the upadhatu of upadhatu of the bone, or the upadhatu of the asti dhatu. The most common sport injuries, chondromalacia pateli, is found into the young adults and young children who use the because of this is chondromalacia patella is sometimes considered as the infective arthritis, but no, it is most commonly happen due to the overuse or over injury. Overuse injury. It is considered as a overuse injury, and the bone you all know it is called as the osteo. So these are the basic six structures which got affected when any joint or any sport injury happens. The pathological terms which are commonly used are the tear. So this tear is used for the is equivalent to the sprain, strain, or rupture. So if there is a muscle tear or muscle sprain is the same thing. Muscle ligament strain or ligament tear is the same thing, or rupture is a synonym to the tear. Then hematoma is also sometimes called in sport injury as a cork. The fracture you all know, and dislocation you all know. There is also one term that is called as subluxation, which is not complete dislocation, but a slight change into the location is called as a subluxation. That is not here. Then you all know about the itis. That is, itis means the inflammation, the protective response to the damage, as well as the initiation of the healing, not the same as infection. So the basically when there is a swelling, there is a swelling in sport injury or any kind of injury. It is the autoimmune response of the body to protect the structure. So the most common example are tendonitis, arthritis, neuritis, myositis. Okay, so now coming to the I hope that you all have got an overview about the sport injuries. Up till now, are there any queries? Up till now, have you got the overview of the sport injuries, and have you understood the scope of these kind of injuries which are happening day to day life to the sportsman and as well as to the everybody around you? So, are there any questions, or are there any query up till now, or should we? Yes, ma'am. Yes, Shubham Oswal sir. Yes, please type your query, or should we proceed to the treatment part? We are also going to take a question answer session after the presentation. Okay, Priya, Raghav madam, all okay. So should we proceed for the treatment part or the management of this sport injuries? Okay, so we will start about the. Okay, the first treatment part, or the first thing you should start with the no harm. So the no harm, it means that no further harm to the injury, and this is also abbreviation that there should be no hit. So in last session also somebody asked me that in Ayurveda we do the Snehan Svedana for the pain or the ligament injury and for the things, and the physiotherapist advise the icing. So what is correct and what is the correct method? So in Ayurveda also, in acute injuries, the parishek and the avleha and the bandhan is advised by the Sushruta. There is no any reference act might be, but I have not found of giving the hot fermentation, giving the Snehan Swedan to the acute injury. So basically, no harm, no heat, no alcohol, no running, and no massage. So we should avoid the massage also when there is an acute injury. So first thing, no harm should be followed. Then the management, the common management, the samanya chikitsa for this sport injury is disease management. That is, first of all, make the patient comfortable, make that injured part rest. Then do the icing alternatively for 10 to 15 minutes, 10 to 15 minutes after every a gap of 15 to 20 minutes for 2 hours. Then take a gap of 3 4 hours, and then do so the first 24 40, at least for first 48 hours. If there is a spot injury, no hot fermentation should be allowed. Only icing should be allowed intermittently for first 24 hours. Then the compression bandaging to the closed injuries and elevation, so that there should not be a swelling or edema at that particular place. So first keep that particular injury into the rest, then do the icing, then do the compression with the help of crepe bandage or with the help of cloth or with the help of other type of taping or bandhan methods. Then the elevation should be given to the that particular part. Then we come to the management, actually that is the doctor ABC. You can remember it by the abbreviation doctor ABC or DRABC. So first of all, reduce the danger. What that is what explained in the Ayurveda also. Nidan Parivarjan. First of all, do the Nidan Parivarjan, then ask for the response, then check for the airway if the patient is more severe or got injured or have a fainting or have unconsciousness. Then check the breathing and then check the pulse or the circulation. So this is what called as a doctor ABC management. This is the updated management protocol for any kind of emergency. So now we are learning all these things, but at the same time, where is the Ayurveda, or what is the point of view of the Ayurveda towards the management of the sport injuries? So in the very first chapter, in the very first shloka of the 18th chapter of the Sushruta Samhita, Sushruta has explained the management of the acute injury in the Vrana Lepana Bandha Vidhi Adhyaya. So in the first ever shlok, what Sushruta says, that the Alep Adya Upakrama Esha Sarvashophanam सामान्य प्रधानतमच्च तच्च प्रतिरोग वक्षायामः ततो बन्धः प्रधानम तेत शुद्धि व्रणरोपण मस्थि संधि स्थैर्यश्च. So you can see that what Sushruta had told. Sushruta had told to do the Alep. Alep is the primary treatment. So Alep, you can compare Alep with nowadays or modern day sprays which are being used in sport injuries. The spraying of the anti what we can say that the anti-inflammatory Alep you can do, the Vedna Sthapan, the painkiller spray you can use, or the nowadays our oils are also coming into the spray. So that spray or that Alep with the Dashang lep or the Hingwastak lep, something sometimes for the swelling purpose you can do. Then यह सर्वशोभों में सामान्य तथा अधिक प्रदाम है. So Alep, so there is nowhere written about the hot fermentation. The Alep is only advised. Then आफ्टर आलेप देयर इज अ बंध. आलेप के पश्चात बंध की प्रधानता होती है. सो एज वी हैव सेड seen into the rest, then icing, that is we can compare with alepan, and then compression, that is what Sushruta had told. Sorry. That is what Sushruta had told in this slogan, that बंधक से व्रण का शोधन रोपण तथा अस्थि और संधियों की स्थिरता होती है. So it means that every structure which has been, because of this compression, because of this bandha, what is happening? The structures which have been ruptured, which have been disturbed, broken, torn, or sprained, they will be stabilized, and they will allow it to heal faster. So this is how brilliantly we can trace the treatment protocols, Ayurvedic treatment protocols in our Sanhitas to manage the sport injuries. So briefing this into the sport injury management protocol. First, apply the RISE protocol, then do a proper diagnosis and decide a treatment plan. Then, if he is a professional sport person or any person who person, we have to bring him back to the sport or back to the work. So the return to the sport, then we have to plan for him to, so that he can return to the sport or return to his daily work or daily activity. Okay, so one more thing, after doing the this all, for the long term, the anatomy structure which can be compared with the Ayurveda point of view, which will help you to use the particular medicines or particular um, modalities according to the granthas, according to the Ayurveda point of view. For example, tendons are the Sira and Kandara, which are the Upadhatu of the Rakta. So, when there is a tendon injury or a tendon rupture or a tendon sprain or strain, then you can follow the treatment or related to the Rakta Dhatu. Then when we called about the ligaments, then they are the Upadhatus of the Med. Snayu is the Upadhatu of the Med Dhatu. So here if there is a Snayugat Vat Lakshana you can find into the ligament injuries. So you can use the particular medicines which are been explained in the treatment of Meda Dhatu, that is for Meda Pachan, you can use. The muscles are the Peshi or the Mas Dhatu. So when there is a muscle injury, when there is a muscle tear, muscle fatigue or muscle, then you have to do the Mansa Chikitsa. All these protocols, all these treatments which are explained into the Granthas regarding Mans Dhatu, we can use. The Barsa is the Picha. Barsa is the basically a fluid filled pockets in between the ligaments and the muscle, between the two anatomical structures, between the two heads of the muscles. For example, suprapatellar bursa is situated beneath the patellar tendon and above the quadriceps tendons. So it protects from friction. It protects friction between the two anatomical structures. Then synovial membrane can be synovial membrane in the membranous joints like knee joints, hip joint. The synovial membrane can be considered with the shleshma, and whatever the treatment shleshma, we can set the protocol. Then the meniscus. Meniscus are the combined structures consisting med, majja, and vasa dhatu lakshana. So we have to treat it. Asti majjagat treatment we can give, or asti majjagat yog. You can use the medo dhatu treatment. Also, we can give like shashti chal for the bruhan of the med dhatu, because if there is a meniscus degeneration, it means that there is a med dhatu kshay. So to increase the med dhatu kshay, we have to do the bruhan chikitsa, the medvardak chikitsa, like shastik shalipindas ved. We have also to give some Bruhan Chikitsa internally. And the last but not least is the bone. You all know about the bone. Bones are the hard tissues, and the if the bone is get hurted, so first of all you have to take X-ray and get confirmed that how bad is the fracture. or how bad is the bone anomaly, and according to you, you can use the different modalities. Okay, then what is the prevention? So how could we prevent this injury? So first of all, do a proper warm up, stretching exercise, and cool down exercise. These three exercise should be included, should be incorporated on daily basis in the to prevent these sport injuries. Then development of skills, the proper skills, proper clothing, and the proper techniques to perform the activity should be developed. The fitness, the overall fitness, the nutrition, the physiological, the anatomical, and the all kind of exercises should be included to achieve the fitness. For example, the cardiac exercises, the weight training exercises, the stretching exercises, every kind of or the maximum kind of exercises should be included into the fitness. Then also for the athletes, they should follow strictly the rules of the games. They should not overstretch or over try to overcome the rules of the game, because they can also create the collisions, the hitting or obstacles, or the fall. So if you follow the proper rule, there are lots of chances to reduce the sport injuries. And also the proper facilities and equipment should be used to practice. Then the most important thing is that a complete exercise program, how should be it ideal exercise program should be done, that the warm up should be first done. The warm up could be the slow walking, calisthenics exercises, jog in the place. This should be done for 5 to 10 minutes. Then stretching should be done from up to down. For example, you should first stretch your neck, then your thoracic, then lumbar, then thighs, knees, and at last at the ankle and the toes you can do the stretching. This should be done to the 20 to 30 minutes as per the strength of the patient. Then active exercises you should advise, that is the cycling, running, dancing, zumba, or any speedly activity that should be done for the 10 to 15 or 20 minutes, or can be done with the repetition. For example, you are doing a cycle, then you ride a cycle for 10 minutes, take a break, and then again start. You are running, then a break after 10 minutes, then again start. So this will allow you to recover the body. Then warm down. Warm down is also called as a calm down or cool down. So the slow walking, calisthenics, and jog in the place. After this main activity, after the stretching and activity exercises, warm up should be done. It should be done for 5 to 10 minutes. Sorry, not warm up. The cool down or the warm down should be done for 5 to 10 minutes, and at the last, the stretching exercises should be done from down to up. When, for example, you have to first stretch your toes, then your ankle, knee, then lumbar. So um, always remember, the stretching which should be done before main activity should be done from upside down, and in the last or the cool after cool down it should be from downward to upward. So this is how a complete exercise program you can prescribe to your patient. Then what is the take home message for this lecture or for this webinar is that there should be accredited, there is a need of accredited sports trainers. So as I have seen that the government of India, the Ministry of Ayush and Sport Ministry are also in a plan to incorporate Ayush into the sport injury management. There are the sport injury management centers, Ayurvedic sport injury management centers opening at the National Institute of Sport, the Sport Authority of India. Also, in the community health program of the Ayush Ministry, they have involved the sport injury management through Ayurveda. Also, there should we should work with a medical team that will help. If you can't perform all the fitness activity your own, you should incorporate with the exercise therapist, the ecotherapist, or a physiotherapist you can take. The rehabilitation and training should be done very properly with by following the established protocol, the evidence-based protocols. And the most important thing that the coaches don't treat and the medicos don't coach. So whatever the teacher, the dancing teacher, the athlete coach, or any coach, he can't treat. So he knows how to improve the strength. So you should always be in touch with the sport coaches, or if there is a dancer or if there is an activity, you should also consider the training process of a particular activity. And first, last of most important thing, that evaluation of the injury should be done very properly, very deeply, very calmly, so that the how better you evaluate the injury, that much better you can manage it. Why we are telling that using the word we are not using the word sport injury treatment, we are using the word sport injury management. Why this is? Because the treatment is just an initiation of the management of the sport injury. We have to follow all these things, that is the prevention, also the treatment and the rehabilitation. So this all comes under the sport injury management, and we should be good at that. Okay, at our Ayurveda multi-speciality structural integration method, at our Ayurveda hospital, we have developed Ayurveda structural integration method, which first in which we first do the diagnosis, then we do the postural evaluation, then we give the Ayurvedic treatment, osteopathic treatment, chiropractic treatments. We also do the dry needling, taping, and muscle energy techniques that are for the rehabilitation. Okay, we'll just in quick see the. I know that you all have been tired now. We are continuously speaking from last more than 1 hour. So quickly, we will see some of the examples. This is the example for the postural evaluation. So you can see in this picture that this athlete is having here a slight scoliosis. Hence, you can see that his right leg is downward and left, uh, yes, that is sacroiliac joint is towards upward. You can see this from these shoulders also. Then when we are seeing it from the lateral view, you can see that the weight which should be parallel, it is not there because there is a kyphotic curve here into the thoracic spine, and he has got the forward neck posture. Then therefore the pressure should be in the center of the knee, but it is not in the center of the knee, and hence his lumbar is getting hurted, or lumbar is getting more posture. If this particular athletes practice for running, there are more chances that his you can also see that there is a tension on the calf muscle. In the both picture, you can see that there is a tension on the calf muscle. So his calf muscle is also at the danger or at the risk of getting hurted. Now, in the last picture, you can see that the athlete is not standing with the straight legs. The right leg is slightly bent towards outward, and this shows the malalignment of his pelvic bone or the pelvic region. So, first of all, while treating him, we have to make the athlete or a person or a patient aware about his posture, and also advise him the correct postures. Then coming, these are some of the other modalities we can use in sport injuries, like dry needling for the knee joint. Then the different kind of kinesiology taping. Kinesiology taping are the tapes which are flexible about 200%. For example, if it is a 1 meter tape, it can be stretched to the 2 meter. And they came in different colors. The more dark color is for the more severe injury. These are some of the examples. These are the tapes which facilitate the athlete to perform better. These are the tapes which decrease the pressure or the stress on the muscle. Okay. Then this is in the left sided picture. Here the white tape you are seeing. This white tape is a hard tape. This is a cotton tape which is to make the shoulder immobile, because for this particular athlete, I will slightly enlarge this picture for you. You can see better. We have this subscapularis and the infraspinatus muscle. We have blocked it from the movement. So to make the particular into the rest, or make that particular portion immobile, so that the soft tissues which are being injured beneath the skin can be at the rest and can heal earlier and proper. Then in this picture you have seen that we have done the weight cupping to an athlete, and this is because the patient has got the injury into the tendon, and as we have seen that the ligaments and the tendons are the rakta upadhatu, and here so we are doing the treatment for the rakta dhatu, because throbbing pain was there, and the throbbing pain is a typical sign of the rakta dhatu drushti. So we have done this weight cupping, and the athlete got result very quickly. So this is how we can incorporate our Ayurvedic treatments, Ayurvedic protocols into the sport injury managements. Then this is the one of the classical example that why you should analyze these sport injuries or any of the injuries, why it is important to understand the injury, and why it is important to diagnose it first. So the reason is that you can see in the above picture there is a slight curve into the ankle, medial side of the ankle, and after treatment, after the facial release and after some of the treatments we are given, you can see that these both legs have become similar and this curve has been straightened up. So the most amazing thing is that this patient never comes to me for the pain in his ankle, but the patient came to me for the knee pain. But when I see and check carefully, I seen nothing. I found nothing into his knee. There is no pain, no any sign or symptom showing any deformity into the knee pain, knee joint, both the knee joint. But when I see him obviously, then I got to know that this particular ankle or this particular Achilles tendon of a patient is a weak, and that's why the tibialis muscle is weak, and that's why that muscle is stretched out, and because of that weakness it becomes the fatigue and somewhat rigid, and it is pulling the talus towards medially, and it has created this curve, and because of this curve his opposite side knee was having more stretch. Because of this, he cannot put complete load on his left knee. So his right knee was bearing more of his body weight and start hurting. So as soon as we have corrected this, in a week, a patient got pain free. So this is how we have to understand and evaluate the injuries and make a proper treatment plan. So if you are what is the perfect, or what can be a good treatment plan, then together we can win for the game. If we as a clinician have good terms and good understanding of injuries, and we can speak with the athletes, we can speak with the coaches, and we can set a particular goal, we can keep the specific goals for the athletes, that what are the specific and the special need of the sport, or if a person is having a particular activity, then what is the specific his need, and according to that need of the body, need of the injury, we can set a good treatment plan, and we can win the game of a injury, against the injury. So thank you all for listening me so calmly, quietly. This is our last year's national winning team. These all are national boxers. Here with the trophy is me, and on my left hand with the red t-shirt, the coach, and all others are the medalists in the national event. So thank you very much for you all. That's all from the presentation. Now we will, yeah, now we will have some question answers. So treatment part. So the first question from Dr. Ashwini Patil, madam. The flat foot, madam. Madam, flat foot is a congenital anomaly. Flat foot is a congenital deformity or condition of that particular person. So you cannot do any treatment for it, but you can manage a very nicely the particular patient. First of all, you should confirm that is it obvious flat foot. Then the proper footwear should be advised. Then some of the exercise like toe walking, the stretching of the plantar fascia, the barefoot walking on the uh, we can see on the marbles, on the uh, outdoor on the ground, that can also increase the sensitivity. Then also some of the lumbar exercise, knee exercises which we prefer. And in flat foot, the calf muscle injuries, the lumbar pain are the common injuries. So while treating the calf injuries or the lumbar injuries, lumbar pain, you have to see for flat foot. So there is no particular treatment for the flat foot. You can prescribe the exercise. Okay, then Shubham Oswal, ligament, knee ligament injury lateral. Madam, lateral injury, I mean, I think you are trying to say that you are speaking uh, basically about the LCL, I think. You are speaking because of LCL. So, first of all, I have said that there are no fixed protocol. I mean, to say that there is no fixed answer to it. Not protocol. There is no fixed answer to it that this is a treatment for this thing. For example, lateral ligament is injured and this is a treatment. First of all, we should come out of this mentality. First of all, we should come out of this mentality that we need a ready-made treatment. First, understand the injury. That it is very uncommon to have the lateral collateral ligament injury, and if it is there, then the how old it is it a chronic or is it a acute injury, and what was the mechanism of the injury, and what is the gradation of that particular injury, that it is it a grade 1, is it a grade 2, is it a grade 3, and is it a grade 4. So there are different protocols for the different gradation. Got it. If it is a grade 1 injury, then you can simply do the Lepan Chikitsa with the proper Asthi Sandhanak lep. You can do. Also, you can do the Dhara. But if it is more than grade 3 or grade 4, then it is better to go for the surgery. Ask the patient that, and one more thing, what is the age of the patient? Because if the age of the patient is above 50-55 years, then there is no need of surgery. You can manage it very beautifully. Then is there a instability in the joint, and what is the nature of the instability, what is the gravity of the instability, you have to understand. First of all, if the acute injury and pain, you have said first, uh, if it is an acute injury, so you have to be sure that it is a LCL, because you can't say that it is the only LCL. It can be anything. It can be a lateral meniscus also. So in any kind of, first of all, do the bend icing. That's what I have explained already. Icing. You can do the Lepan Chikitsa with Bandha. Make that particular joint immobile. Start with the Vedna Sthapan Dravya like Shallaki. You can use the Shothar Dravya, the Shothar Lepan. All that you can do to reduce the acute pain. Then that is what the acute injury, how to manage in sports and pain. That is what I have shared this slide also about with the RICE protocol and with the reference from Sushrut Samhita. Okay. Then calcaneal spur. So, and calcaneal spur is basically try to understand the mechanism of injury or why it has happened. Calcaneal spur is a reaction of the body. It is not a disease, it is a reaction of the body. Before calcaneal spur, the patient must have experienced the plantar fasciitis, and because of the plantar fasciitis, patient have developed the calcaneal spur. And why there is the calcaneal spur? Because the plantar fasciitis was not taken care properly. And why the plantar fasciitis happened? It may be happened because of the long standing. So first of all, the Nidan Parivarjan is the first treatment for the calcaneal spur. Then there are certain exercises, there are certain treatment, there are certain exercises, there are certain pathyapatyas. Alpa Thakur madam. Madam, I will let you keep your hand up. I will let you speak. Anybody who want to ask directly question, who want to speak, can raise his hand. I will just finish this answer and allow you to speak. Then this calcaneal spur can be managed with the Mrutika Shalaka also, but that will give you the temporary release. You may do 2, 3 times, 4 times Agni Karma, but if the patient's pain not relieved or not gone, then it means that you are missing the mechanism, you are missing the Nidan. So the first principle of the Chikitsa is Nidana Parivarjana. So what was its Nidan? What was the cause of that calcaneal spur? Is the long, I have done a study for the heel pain of nearly 157 patients. Sorry, about 170 patients. And out of 170 patients, I found one of the common reason is that drinking water empty stomach. Drinking water empty stomach is the common cause in 157 out of 170 patients. And when I advise them with a minimal medication to avoid the Ushappan, that is drinking water empty stomach, they 157 out of 157 near have the less pain, and around 98 patient got complete relief from the heel pain. So that's why I always insist on the mechanism, on the pathology, samprapti, the cause of the particular injury, particular pain. Okay. Yes, Alpa madam, you can ask your question now. Dr. Alpa madam, Alpa
Mm,
Thaker. Am I audible to you? Are you there?
yes, sir.
Yeah, please ask your question.
Sir, for osteophytes in knee joint, something.
Same thing what I have explained for the osteophytes are the reaction of the body.
Huh.
Osteophytes for the protection of this particular joint. So
Huh.
you don't have to focus on osteophytes. You have to focus on the impaired structure.
Okay.
You will never see a patient directly with a osteophyte.
Huh.
There is a meniscal degeneration, there is a dehydration of the synovial fluid, there is a dehydration of the soft tissues, there is a rigidity in the ligaments, there is a stress on the quadriceps, hamstring, and the tibial ligaments. All that is a syndrome, and because of this, all degeneration and dehydration of that anatomical structures, in reaction to this degeneration and dehydration, osteophytes are formed.
Hmm.
So when you will treat all this, that osteophyte will be no more a issue.
Okay.
You
But there is
can
a swelling in knee joint, osteophytes in knee joints, and swelling in knee joint, and just problem in walking and during not running, but during walking, patients feel pain, and also even night when in rest position, knee at that time also getting pain, not swelling, a mild swelling, and this
you
is patient with OA, osteoarthritis,
no, no. First of
mild
all,
narrowing knee joints, and
yes.
patients also doing activities related to sports.
Okay, now listen to me.
Hmm.
First of all, we have to understand. Dr. Radhika, I will allow you your question. Please give me some minute. I will complete the answer to Dr. Alpa. So, this is important for all of you. First of all, what Dr. Alpa has said, that the patient is having the mild swelling, then the patient is having the osteophytes, then patient is having the OA. So we have to differentiate these things. These are not the one thing. First of all, osteoarthritis is a diagnosis.
Huh.
Okay. So osteoarthritis is a diagnosis. So we will keep it a little aside. Then you have said osteophyte and swelling. The osteophyte and swelling are the reactions of the body to protect the further injury to the knee joint.
Hmm.
Okay. Then you also said that there is a mild narrowing. This is a radiological finding you have said.
Huh.
You can't say it without X-ray or MRI.
Huh.
Okay. So this is a radiological finding.
Huh.
Narrowing of the joint space is a okay. So
Huh.
what you want to try treat? Do you have to treat the osteoarthritis? Do you want to treat the osteophyte? Do you want to treat the swelling? Do you want to treat that narrowing of the joint space? What do you want to treat?
Actually,
You
patient want to
don't.
do
First of
sports
all,
activity.
Alpha, please allow me to complete.
Okay, sir.
You what patient want is not necessary.
Okay.
First of all, if a patient come to you and he will say that I want to, what is the age of the patient?
Patient says almost 57.
57.
Huh.
57, and he will now tell you that I want to play for India. I want to do the
No, no,
India.
but generally
Okay.
interest.
So there is no. First of all, you are a doctor, so
Hmm.
you should decide that how should be the progress of the treatment. How
Hmm.
should be the treatment of the plan? So first of all, you are mixing up all the things. First, sort out all the things. So whatever osteoarthritis, keep aside. Okay.
Hmm.
Then come to the swelling. It is a reaction. Why it is reacting? Why it is swelling or the, because there is a degeneration, there is a injuries to the joint structures. Which structures? There may be a meniscus tear, there may be a ACL tear, there may be a LCL tear, there may be a fatigue into the pes anserin bursitis, there may be a pes anserin bursitis, there may be a patellofemoral degeneration, there may be a patellotibial degeneration. These all kind of structures may be, and all these structures or all these deformities can manifest into the osteophytes or swelling. So first of all, you have to find that what injury has been happened to which structure. Is it a ligament injury? Is it a muscular injury? Is it a meniscal injury?
History of synovitis where he
Madam,
got
this is a
injury.
history. What I have said, we are speaking here 5 minutes. In the lockdown, some of my friends, some of my colleagues, students say me, sir, we will take some lectures. And we have launched a online program called VEDA, okay, for knee joint pain. And I have decided that we will finish it into the 3-4 lectures. Okay. But madam, when I started explaining and training, it took 14 lectures. It means that it took approximately 28 continuous hours to explain the knee injuries and knee rehabilitation. So it is not that you are saying that I can't give you the ready-made formula that do this and it will be okay.
Okay, sir.
Got it? First of all, what is the condition of ACL? What is the condition of his or her meniscus? What is the gravity of the injury? What is the history? Synovitis is a different thing. There, what I have said, there may be a chondromalacia patelli, there may be a meniscal tear, there may be a ACL tear, there may be the hardening of the tissue, there may be a bursitis. There are lots of things. We are the Ayurveda Charyas. So always basically depend on the Trivid Pariksha. That is Darshan, Sparshan and Sparsha Pariksha. You are telling what patient had told you. You are not telling anything what you have experienced. What was there, have you gone through the anterior drawer test? What is the level of instability? What is the level of, what is the feel of the patient? What is the feel of the swelling? Is it warm? Was it cold? Was it was there a sparsha asahatva? Was patient, what is the morning stiffness condition of the particular joint? And again, is there a pitting edema or is there a non-pitting edema? Is there any tenderness at any part of the joint? What is the so these thousands of questions arises when you tell this condition. So to understand it better, you have to first understand the knee. What is knee and what is we are dealing with. Got it?
Yes, sir.
So you can message me personally. You can discuss this case personally with me. Okay.
Okay.
We
Okay,
will
sir.
take next question. Somebody was raising his hand, his or her hand. ओके. पेशंट टेंडॉन टियर साठी काय करू शकतो? डॉक्टर राधिका मॅडम. येस. येस मॅडम.
हेलो.
हाँ मैडम बोला.
हाँ सर, टेनिस एल्बो के लिए क्या ट्रीटमेंट दे सकते हैं आयुर्वेद
मैडम
के?
मैंने अभी एक बात बोला कि नेवर आस्क मी टेनिस एल्बो. फर्स्ट ऑफ ऑल, हैव यू कंफर्म इट विद द टेनिस एल्बो? व्हाट इज द टेक्निकल नेम ऑफ द टेनिस एल्बो?
जो वो तो पर्टिकुलर ये है ना कि कुछ पिक
मतलब
करके
क्या बोलते हैं उसको?
अभी याद नहीं आ रहा है उसको क्या बोलते हैं, लेकिन
उसको लैटरल एपिकोंडाइटिस बोलते हैं.
कौन से इसमें होता है टेनिस एल्बो?
लैटरल एपिकोंडाइटिस बोलते हैं टेनिस एल्बो को.
यस.
तो लैटरल एपिकोंडाइटिस क्यों होता है?
स्वेलिंग.
क्यों आती है स्वेलिंग?
इंजुरी, कंटिन्यूस है.
कैसी इंजुरीज? कौन सी इंजुरीज?
होमवर्क करने से होता होगा. कंटिन्यू सेम वर्क करने से होता होगा।
ओके, तो मैंने अभी लेक्चर में भी बताया था, आई हैव डिस्कस अबाउट दी टेनिस एल्बो आल्सो कि इट इज अ क्रॉनिक इंजरी और ओवर यूज इंजरी।
यस।
तो किस पोजीशन में ओवर यूज इंजरी हो रहा है और वो पेशेंट क्या कर रहा है, व्हाट आपको उसको मैंने क्या बोला कि मोस्ट इंपॉर्टेंट थिंग, अगर आपको स्पोर्ट इंजरी समझना है, अगर आपको स्पोर्ट इंजरी को ट्रीट करना है, तो आपको स्पोर्ट इंजरी को समझना पड़ेगा कि वो क्यों हुई है।
ओके।
अगर ओवर यूज इंजरी है, अभी आपने आपका ये एग्जांपल दिया, वेरी करेक्ट आंसर यू हैव गिवन कि एक ही काम बार बार करने से टेनिस एल्बो हो रहा है शायद। ओके, तो आपने ट्रीटमेंट करने के बाद पेशेंट 2 मिनट के लिए हम समझते हैं कि हमने ट्रीटमेंट कर दी उसकी, तो वो काम बार बार करना बंद कर देगा पेशेंट?
उसका काम ही वही रहेगा, तो क्या उसको ऑप्शन दे सकते हैं?
देन
अगर
फिर कोई कौन सी ट्रीटमेंट काम करेगी उसमें? तो फर्स्ट ऑफ ऑल यू हैव टू अंडरस्टैंड, हमें इसीलिए हम स्पोर्ट इंजरी को ट्रीटमेंट नहीं बोलते हैं, मैनेजमेंट बोलते हैं। दिस इज अ परफेक्ट एग्जांपल कि
ओके।
अगर ओवर यूज इंजरी है, पेशेंट एक ही काम बार बार करने वाला है, तो पहले तो आप टेनिस एल्बो को समझिए कि इज इट अ टेनिस एल्बो। आपको पता है क्या, अगर ओवर यूज इंजरी में अगर उसके जो फोर आर्म एक्सटेंशन मसल है, अगर एक्सटेंशन मसल पे बार बार प्रेशर आ रहा होगा तो भी यहाँ पर पेन होता है, लैटरल
यस।
एपिकॉन्डिलाइटिस के एरिया में पेन होता है, मगर वो
यस।
जरूरी नहीं है कि वो टेनिस एल्बो ही हो, यानी वो लैटरल एपिकॉन्डिलाइटिस ही हो, ये जरूरी नहीं है। इट इज जस्ट कि जो ये एक्सटेंशन मसल है यहाँ पे फटीग भी हो सकता है, अगर ये मसल फटीग हो रही है तो भी यहाँ पेन होगा, तो यहाँ पे कितनी भी ट्रीटमेंट कर लो। मैं आपको ये एंड सॉरी टू से, बट मैं आपको ऐसा एक वर्ड में आंसर नहीं दे सकता कि ये ट्रीटमेंट है। मैं बोल सकता हूँ कि ठीक है अग्निकर्म कर लो, हो जाएगा, लेकिन आप अग्निकर्म करोगे, वो पेशेंट ठीक हो जाएगा, 4 दिन बाद वापस आएगा कि मैडम आपने अग्निकर्म किया, मुझे 4 दिन अच्छा लगा, अब वापस दुख रहा है, तो क्या करेंगे? कितनी बार अग्निकर्म करोगे उसका आप? और आपको लगता है कि पेशेंट का कॉन्फिडेंस और आपका कॉन्फिडेंस सेम रहेगा अगर ये रिपीटेड होते रहेगा तो? इसका रीजन ऐसा है कि आपने ये समझा ही नहीं कि उसको इंजरी क्यों हो रहा है। तो मेरा आप लोगों से, सब लोगों से ये एग्जांपल है कि भाई सर, अगर टेनिस एल्बो है तो इसके डिफरेंशियल डायग्नोसिस क्या क्या होने चाहिए? बराबर है, टेनिस एल्बो हो रहा है तो क्यों हो रहा है, या टेनिस एल्बो हर बार यहाँ पे जो पेन होता है वो टेनिस एल्बो ही होता है क्या, या किसी दूसरे रीजन से भी यहाँ पे पेन होना है? लेटरल एपिकोंडाइल या एल्बो के लेटरल साइड में जो पेन होता है वो क्या केवल टेनिस एल्बो की वजह से ही होता है क्या? ऐसा ही फ्रोजन शोल्डर के बारे में है। 90% लोग जो बोलते हैं कि फ्रोजन शोल्डर है, उनको फ्रोजन शोल्डर होता ही नहीं है। तो बहुत बार हम उसको अग्निकर्म करते हैं, वेदन कर्म करते हैं, स्नेहन स्वेदन करते हैं, लेकिन पेशेंट को ठीक लगता नहीं है, या कुछ देर के लिए ठीक लगता है, वापस वैसे ही हो जाता है। इसका मेन रीजन ये है कि हम उसको बिना समझे डायरेक्टली ट्रीटमेंट पे जंप करते हैं। अभी भी मैंने सबसे पहले जो अलवा मैडम थे उनको यही बताया कि आप, मुझे घुटनों में दर्द है और उसके लिए ट्रीटमेंट क्या है। तो दिस इज नॉट अ क्वेश्चन फ्रॉम, यानी ये क्वेश्चन ही नहीं है। क्वेश्चन ये है कि टेनिस एल्बो हुआ है तो क्या हुआ है, एक्चुअली क्या हुआ है, आपको ट्रीटमेंट क्या करना है? टेनिस एल्बो इस वर्ड को करना है क्या आपको ट्रीटमेंट? आपको ट्रीटमेंट उस स्ट्रक्चर को करना पड़ेगा जो स्ट्रक्चर हर्ट हुआ है, जो स्ट्रक्चर में प्रॉब्लम है, बराबर है?
ओके।
तो जो स्ट्रक्चर में प्रॉब्लम है, पहले हमें ये तो समझना पड़ेगा कि वो कौन से स्ट्रक्चर में प्रॉब्लम है। अब अगर आप बोल रहे हो कि टिपिकल टेनिस एल्बो है, हम 2 मिनट के लिए कंसिडर करते हैं कि इट इज अ टिपिकल टेनिस एल्बो, जिसको कि हम लैटरल एपिकोंडाइलिटिस बोलते हैं, जो कि लिगामेंट का ये जो लैटरल एपिकोंडाइल होता है, एक्सटेंशन मसल का लैटरल एपिकोंडाइल के बार बार फ्रिक्शन होने से वो इंजरी होता है। तो वहां पर आपका जो मसल का टेंडन है, एक्सटेंशन मसल का, वो रप्चर हुआ है, वो इंज्योर हुआ है। तो फर्स्ट ट्रीटमेंट उसको जो एक्यूट में करते हैं वही करना पड़ेगा, फर्स्ट उसको रेस्ट देना पड़ेगा। आपने देखा होगा कि टेनिस एल्बो का एक बेल्ट आता है जो यहां बांधते हैं, जिससे कि यहाँ का फ्रिक्शन कम हो जाएगा। देन आपको वहां पे शोथहर लेपन करना पड़ेगा। शोथहर लेपन करने के बाद आप उसको निर्गुंडी घनवटी दे सकते हो। अगर बाकी उसकी जो प्रकृति अनुसार ट्रीटमेंट देना है वो दे सकते हो। इसके बाद अगर आपको फिर वहां पे कोई पिन पॉइंट बचता है कि जो पेन है, जहां पे ट्रिगर पॉइंट है, जहां पे दबाने से बहुत ज्यादा स्ट्राइक हो रहा है, तो फिर वहां पे आपको अग्निकर्म कर सकते हैं। लेकिन फर्स्ट ऑफ ऑल ये समझना है, इसका मतलब वो टेंडन इंजुरी है, इसका मतलब वो रक्त धातु से रिलेटेड है, तो आपको वहां रक्त मोक्षण भी करना पड़ेगा। मोस्ट प्रोबेबली अगर आप कर सकते हो तो डायरेक्ट वेट कपिंग कर सकते हो, या फिर जलौ का उच्चारण भी वहां कर सकते हैं फॉर लॉन्ग टर्म रिलीफ। ठीक है, लेकिन इससे पहले आपको बेसिकली समझना पड़ेगा कि वहां पे प्रॉब्लम क्या है। सिर्फ पेशेंट बोलता है मुझे टेनिस एल्बो है, या सिर्फ उसका एल्बो पेन हो रहा है तो वो टेनिस एल्बो है, ऐसा करके नहीं चलेगा, है ना। और यही सब हम हमारे जो स्पोर्ट वेदा का जो हम स्पोर्ट इंजरी मैनेजमेंट का जो कोर्स लेने जा रहे हैं, उसमें 7 लेक्चर्स है, और इसमें यही सारी अंडरस्टैंडिंग हमने दी है कि लिगामेंट पे दिक्कत है तो क्या करना चाहिए, मसल में दिक्कत है तो क्या करना चाहिए, और उसी में हम उसको डिटेल में उस पर डिस्कस करने वाले हैं।
ओके, यस सर,
ओके, इज देयर एनी मोर क्वेश्चंस?
थैंक यू सर।
थैंक यू मैम। Dr. Kanchan, explain Ayurvedic treatment of any sport injury in detail to better understanding. अभी जैसा मैंने बताया, आई थिंक दैट आई हैव आंसर्ड योर क्वेश्चन डॉक्टर कांचन। टेनिस एल्बो के लिए जो मैंने डिटेल बताया कि यू हैव टू इवेल्युएट, देन जो ट्रीटमेंट पार्ट बताया मैंने पूरा का पूरा आयुर्वेदिक ही बताया कि यू कैन डू दी अग्निकर्म, यू कैन डू दी रक्त मोक्षण और जलव का उच्चारण, because it is related to the tendon, and tendon is a upadhatu of manj dhatu, and that epicondylitis, it means that there is a swelling, so for that swelling you have to do the shothar lepan, then you have to do the rakta mokshan, and after that still there is a pain for particular thing, particular there pain is there, then we can do the agnikarma. So this is how we can manage the sport injury with the both, and then after you have to do the exercises, you have to prescribe the exercises, rehab exercises, strengthening exercises, and all these things. So any more questions? Any questions or queries related to partial tendon tear साठी काय करू शकतो? Partial tendon tear में भी सेम थिंग वही करना है कि उसको स्टेबिलाइज करना है। यू कैन यूज द संधानक लेप, then you can use the sandhanak gana aushadhis to heal. Then where is the tendon, that also depends. Any queries or should we wind up? Okay, then I think that there are no more queries, no more questions from your side. Okay, somebody has. Do you provide hard copy of the certificate? No, I will let you know. I will give your. I will forward your query to the organizers, because basically I am involving in teaching, and I can share you all the knowledge which I have. For this particular query, I will refer to Dr. Lalit Theda or Manju Chitte ma'am. They can answer you better. I will share your query with them. Any other questions related to course, related to today's sport injury management lecture, or any diagnosis or anything you want to understand? Okay, then see you. Somebody has raised the hand. Okay. Yes, Dr. Alpa, ma'am.
Hello, sir. Swimming is helpful or not for that knee problem or any bone joints problem? Swimming.
It is very useful, madam.
Okay. Thank you, sir.